Hi everyone, I'm Bill Phillips, Editor-in-Chief of Men's Health Magazine. Welcome to National Men's Health Week 2013. Also welcome to our first ever Google Plus chat. Hanging out with us today is Dr. Thomas Frieden from the CDC. Dr. Frieden's been there since 2009. You may also know him from his previous role as the New York City Health Commissioner. Dr. Frieden, in that role, made it his mission to reduce the prevalence of smoking in New York. And what was first considered a very controversial initiative, banning smoking in bars and restaurants and workplaces, is now basically been termed an epic success. He cut New York City's smoking rate by 25%. Perhaps more importantly, the teen smoking rate by 50%. It's still half the national average, so it's been a huge success there. Dr. Frieden is also Men's Health's news contributor. This is our July-August issue on newsstands next week, and Dr. Frieden wrote this piece, How to Save the U.S. Male. So we're going to talk to him about how guys can live happier, healthier, longer lives. Dr. Frieden, welcome.
Great to be here. Glad to do this with you, and thanks for putting attention on health issues. They're so important.
You're very welcome. Very welcome. Let's start at the top. The top being the #1 health threat for men, which is heart disease. And the thing I've always wondered, it is the #1 killer of men. I've always wondered why the medical establishment hasn't been more proactive in testing for heart disease. Like with prostate cancer, we have PSA testing. Shouldn't there be an equivalent for heart disease?
Well, there is. Really, several simple questions. First, do you smoke? Second, what's your blood pressure? And third, are you physically active? If you can get those three things right, you can cut your risk of heart disease more than in half. So a lot of the things that guys can do to feel better and live longer really aren't that complicated, but they're very important.
You mentioned smoking, and that's obviously been a huge issue for you just because of the health consequences. If you smoke, what would you do? How would you go about quitting?
Well, first, to understand that if you smoke, quitting is by far the single most important thing you can do to improve your own health. And in addition, to know that every American, first off, most Americans who've ever smoked have already quit. So if you're still smoking, you're not in the majority there. You're in a minority. Most people have already quit, and you can too. Anyone who smokes can quit, but there's certain things that make it easier. So quitting with a buddy, using medications which double or triple the likelihood that you will quit successfully, identifying what your triggers are so you can eliminate those triggers, doing things that support yourself during the time that you want to quit. So get a buddy, use medications, have a quit date, eliminate ashtrays and other triggers, maybe spend your time with people who don't smoke for a few weeks until it gets solid in, and understanding that for most people, quitting smoking takes a few tries. So be good to yourself. If it doesn't work the first time, try again, because you can succeed. And it's not only important for you, it's important for everyone around you. Smoking not only makes it more likely that you will get bad diseases, it also makes it more likely, twice as likely your kids will smoke, more likely that people around you will get lung disease or heart disease or cancer. So lots of really serious health problems from smoking. I think we're all still kind of have the allure of the Marlboro Man, right? The sexy, smoker, rugged individual. I'm a doctor. I've taken care of so many patients who've had such awful experiences with smoking. People who are gasping for every breath with emphysema, people who have had their leg amputated, one man who desperately wanted to live to see his son graduate from college and didn't because of his smoking, another guy who ended up dying while waiting for a heart transplant. So these are terrible problems, and we can prevent them. It's not easy to quit smoking, but you can do it.
How would, if you have, someone close to you, a spouse, a family member who's a smoker, like how would you go about, you know, inspiring them to try to quit? Any tips you can give the folks watching about how they might go to someone they care about to get them to give it up, or at least give it a try?
There's a lot that you can do to help someone else quit. So, for example, you can encourage them to see the doctor and get medications. You can help them identify other smokers who also want to quit with them, because going through it together is really helpful. You can understand that some people may not be ready to quit and just come back at it and come back at it until they are ready. So just keeping in mind that smoking remains the #1 preventable cause of death in this country, and it causes not only death but really terrible disability, disfigurement, inability to go about and do the things that you want to do. So if you quit smoking, you're going to feel better, you're going to live longer, and you'll be happier.